Good evening, guys. Tonight's D is how housing shortages are leaving seniors lonely and empty nests. A growing shortage of housing inventory in the U.S. is creating lonely nests. Homes that once had vibrant communities now are communities, but now feel abandoned, with seniors aging in place, not by choice, but by economic necessity. Finance. The problem. Many baby boomers want to right size their homes, downsizing to something smaller, lower maintenance, and closer to family, but in high demand markets like San Francisco, even a modest 2-bedroom condo can cost over $1 million before HOA fees, insurance hikes, and new property taxes. Finances in rural areas. Fire insurance premiums can reveal a second mortgage, making quieter, cheaper options unaffordable. Why they stay. The available alternatives are often either older homes needing costly renovations or locations that eliminate the financial benefit of selling. As a result, many seniors remain in larger homes longer than planned, sometimes installing chairlifts instead of moving to a one-story home in places like Palm Beach, Florida. The category most wanted. Well located, low maintenance condos and townhouses. With quality finishes. Has the thinnest inventory. Loneliness and isolation. This housing mismatch is compounded by demographic shifts. Children move away, friends relocate, and neighborhoods change. Harvard's Joint Center for Housing studies projects that by 2038, 17.5 million households headed by someone over 80 will exist, and 10.1 million adults 80 plus will live alone. Harvard Magazine. Loneliness is linked to serious health risks, including depression, cognitive decline, and higher mortality. Broader contexts. Experts stress that aging in place isn't just about the home, it's also about the neighborhoods, amenities, walkability, and access to services. Without these, even a familiar house can feel isolating. Implications. The lack of affordable, accessible housing options is trapping seniors in homes that no longer fit their needs, eroding social connections, and contributing to a loneliness epidemic. Addressing this requires targeted housing policies, community design that supports older adults, and strategies to connect seniors with social networks. Social isolation and health in social isolation and health in empty nests. Older adults integrative review findings. An alternative integrative review of 14 studies, mixed methods, quantitative 11, quantitative found that social isolation significantly harms both physical and mental health in empty nest older adults. Physical health impacts, increased mortality risks, socially isolated empty nests. Older adults show higher rates of death compared to those with active social networks, chronic disease, and functional decline. Isolation is linked to poorer cardiovascular health, reduced mobility, and higher rates of chronic conditions. Intrinsic capacity decline. This refers to the ability to perform daily activities independently, which diminishes with isolation. Mental health impacts. Depression and anxiety strongly associated with social isolation, often exacerbated by loneliness. Loneliness, a core mediator, intensifying both emotional distress and health risks. Reduced life satisfaction. Isolated individuals report lower overall well being and happiness. Cognitive decline. Social disconnection is linked to faster cognitive dis, uh, deterioration and increased risk of dementia. Self neglect, lack of social support can lead to reduced engagement in health promoting behaviors. Mediating and moderating factors. Aging attitudes. Negative views toward aging can worsen isolation effects. Perceived stress. Higher stress levels amplify the health risks of isolation. Health promoting behaviors, limited engagement in physical activity, healthy eating, or social activities can exacerbate outcomes. Quality of life. Social isolation negatively affects quality of life across multiple domains, including emotional, social, and physical well being. Conclusions and recommendations. The review concludes that social isolation is a critical public health concern for empty nest older adults. Both physical and mental health consequences. Interventions should focus on expanding social support networks, family, friends, community groups, engaging participation in social, recreational, and health related activities, addressing loneliness through targeted programs, promoting health, promoting behaviors to counteract isolation related decline. In summary, for empty nesters, older adults, maintaining social connection is as important as physical activity and nutrition for long-term health. Public health strategies should integrate social engagement in care plans for this vulnerable group. Frailty and social isolation, interconnected public health challenges. Frailty and social isolation are two major uh, interrelated conditions that significantly impact older adults' health, increasing the risk of dementia, hospitalization, and mortality. The Lancet frailty refers to a state of reduced psychological reserve, while social isolation is the lack of meaningful social connection and support. Both can independently and together accelerate functional decline and chronic disease progression. Prevalence and impact. Frailty affects about 12 to 24% of adults age 50 globally. The Lancet social isolation affects roughly 1 in 4 adults age 60. In the US, 1 in 3 adults report feeling lonely, and 1 in 4 report lacking social and emotional support. About 14.7% of community dwelling adults over 65 are both pre-frail and socially isolated. Health consequences. Social isolation and loneliness are linked to physical health. Poor nutrition, sedentary behavior, excessive alcohol use, heart disease, type 2 diabetes, and earlier death. Mental health, depression, anxiety, suicidal, and reduced quality of life. Functional decline, reduced participation in social activities, slower recovery from illness, and higher hospitalization rates. Mechanisms of interaction. Frailty limits social participation, which in turn reduces opportunities for physical activity, social support, and healthy behaviors. Worsening frailty, loneliness as a risk factor. Longitudinal studies show high loneliness increases the risk of becoming physically frail or pre-frail by 17185 times over 4 years. Social isolation in men. Higher risk of frailty progression. Men with higher social isolation. Policy and care priorities. Public health viewpoints. Proposes 4 priorities. Screening in primary and acute care for both frailty and social isolation. Integrated medical and social care to address co-occurring needs. Social prescribing, linking patients to community resources and activities. Equity-focused policy and research within aging strategies. Structural barriers, cultural, linguistic, financial, geographical, and care coordination challenges can limit access to interventions. In summary, frailty and social isolation are not isolated issues. They are intertwined public health challenges that require coordinated cross-sector approaches to promote healthy aging, early screenings, and integrated care. And community-based interventions are key to breaking the cycle of decline. Okay, guys, that is it for tonight. I'll be back on tomorrow for shows. For now, Gator Wellness, take care, folks.